designer drugs. We'd really like to thank Catalina Island Health for bringing us over from St. Mary Medical Center to educate you on this really important healthcare topic. My name is Kathy Dollarhide, and I'm a nurse, and I have with me...
Hi, I'm Matt Wojcik. I also work with Kathy at St. Mary. We do the emergency management and the trauma surge planning.
And he's a lifeguard, so he's going to talk about field response. And then with us this evening, we have...
Salvador Pedrosa, medical assistant.
He's going to be translating this evening's presentation in Spanish for us. So I really appreciate those of you that came tonight. The reason that we're here tonight is to talk about what the first line of defense is for drug abuse. And for teenagers and small children, really the first line of defense is nurses, doctors, and parents. When my own children were growing up, I did this lecture for years at their high school. And when my daughter went to Cal State Long Beach, she said, "Mom, these kids really need to learn more about ecstasy and ketamine because they're dying. They're taking it without knowing the dangers." So as paramedics, first responders, nurses, we really need to stay on top of what the drugs of abuse are so that we as healthcare workers can educate. So where I get most of the information is from the teenagers that we take care of in the emergency departments. So we want to know about how to have an open conversation, non-judgmental, so that kids can come and talk to us about drugs. And then how do you get off the island? If you have an overdose over here, it was a very bad day, and we've got a local trauma center, we might have to send you over by boat. And so we're going to talk about NARCAN because it's so important to have NARCAN here on the island because it's a reversal agent for some agencies. How about those cruise ship visitors? We saw a lot of them today coming off the boat. What if one of them overdosed because they're bringing drugs to the island?
You have to get a little closer.
Okay, this closer to her. Okay. Oh, this one.
So let's talk about pathophysiology. Why are teenagers and children so dangerous when it comes to drugs? Most teenagers think they're invincible. They're good athletes, they've got, great body, muscle, and they have a change in metabolism. But designer drugs can be very fatal to very young people. The thing that we really worry about is the smaller children, like the kindergartners and the preschoolers, that maybe they're in their brother or sister's room and they find the drugs of abuse in the drawer of their brother and sister, and tiny little bodies overdose very easily.
Aquí están hablando acerca de las advertencias que tiene que tener uno con los hijos y los niños y adolescentes. Ellos pueden pensar que son invisibles y puede estar en el cajón o en el armario de sus hermanos y pueden abrir el cajón o el armario y no saber qué están tomando al instante.
So I'm going to challenge those of you that are here in the room tonight and those at home. What's in your medicine cabinet? Do you have Vicodin? Do you have oxycodone? Do you have a pharmacy of drugs right in grandma's medicine cabinet? A lot of times teenagers can get the drugs just from in their family's cabinets. So let's talk about poison control. This is a number that everybody should have in your phone. It's really a 24-hour-a-day, 7-day-a-week system, 1-800-222-1222. And if you have this phone number, whether your child took Drano that they found under the kitchen cabinet, or they swallowed bleach, whatever it is, or they took an unknown drug or a substance, first call 911, and then second, if you find a pill bottle, call the poison control.
Este número de teléfono es un número de teléfono muy importante que cada persona en su hogar debe de tener. Es el número de teléfono del Poison Control. En caso de que uno de sus hijos tome un medicamento o por casualidad tome cloro o inhale algo, por favor, no duden en marcar al 911 primero y seguido de ese, marcar al Poison Control, que es el número 1-800-222-1222.
Let's talk about pink cocaine. Some of you might have seen on the news, or if you read People magazine that you get at Vaughn's, that there was a gentleman by the name of Liam Payne. He was in a group called One Direction, and he literally took this stuff, that he didn't know what was in it, and it was called pink cocaine, and he fell off a third-story balcony. It's a psychedelic drug that pretty much makes you unaware of what you're doing, and if a drug makes you that altered that you can fall off a third-floor balcony, that's a pretty dangerous drug. So if you see anything pink, that's kind of dangerous because a lot of young girls see something that looks pink, it looks very attractive, and they think that it's not dangerous because it's colored pink. It's also called 2C. So if you hear some of the kids talking about 2C, or they're rolling 2CB, or they're taking pink cocaine, that's one of them. Matthew, tell us about why these drugs look so scary to you as a first responder.
So a lot of times, I'll just kind of introduce myself, what I do on the beach. So I'm one of the EMT supervisors in Huntington Beach. So we go through any 911 call on PCH, on the beach, and then 3 miles offshore. So we see a lot of this stuff come up with a lot of the kids that go down the beach. They're obviously most of the time alone. So the parents drop them off on the beach. They go and they take a lot of these pills that look like normal candies, right? And they know they're drugs, but they're a little bit more exciting for them rather than the cocaine and the heroin. And a lot of times we find that their kids are actually scared of the regular cocaine, the regular heroin, because of the social implications of it. This kind of deteriorates that social implication of it and says, hey, this looks more normal, and they start to take it. So we find, and I'm going to go through a little bit more later on with NARCAN use, what we see and what it looks like to show up late to a call. And a lot of times, kids go down to the beach and they're really scared to call 911. They'd rather see their friend overdose than call 911. And then eventually someone comes on, and then we have to deal with it that way. So what we're trying to do is encourage families to help educate their own kids that, hey, it is safe to call 911, and first responders are here to help. And if you do get yourself in this situation, we can help you better if you call 911. And a lot of times, and obviously I'm sure you guys have probably read in the newspaper, there's a lot of times where they don't call 911, and it's a bigger issue. So yeah, we see a lot of this stuff, and it's kind of a new trend with the fentanyl and all this other stuff and lacing other drugs, is they lace it into other things that you don't know. So for your parents at home, if you do see something that looks a little bit weird, check up on it, right? If you look over to the right, the Jolly Ranchers and the Sour Patch Kid stuff, it looks similar, but it's not, right? So if you get a real deep dive into it, if you see something that looks even just a little bit off, go investigate it a little bit further.
Las imágenes que estamos mirando son imágenes de diferentes tipos de dulces que parecen dulces específicos que pueden comprar regularmente en una tienda, pero en realidad no son los dulces regulares que normal uno compraría. Y lo que están tratando de explicar es que uno debe prestar mucha atención a la imagen de cómo se mira esto y tener cuidado en consumirlos, porque muchas veces los consumen a menores de edad, y en ese tiempo puede tener una sobredosis y puede estar con un amigo en la playa o en algún otro lugar, y en vez de hablar al 911, dejan que el amigo esté pasando de una sobredosis, y puede ser muy arriesgoso.
Here's another that, some of you might recognize him. He was on TV for many years, and this gentleman was a grown adult, so it's not just teenagers that we worry about. He knew he was taking ketamine. He had people coming to his hot tub injecting him with ketamine, and he died from ketamine. So even though people think, oh, it's a designer drug, it's a safe drug, it'll kill you. And this gentleman was actually paying people to come to his house, and his name was Matthew Perry, and he died from ketamine. And what a tragic loss, this famous actor dying of ketamine. Why am I so scared as an ER nurse about fentanyl? Because you have no idea what's in that pill. You can buy it for $5 down at the local store. Girls can get it for free from a guy, and they take a pill that they have no idea what's in it. And fentanyl is now being mixed with something called hydralazine, which is an elephant tranquilizer. We can reverse fentanyl with NARCAN. There is no reversal agency for hydralazine. So the kid just dies, and they boil to death. That's why it's so scary with fentanyl.
One more thing on this too, with fentanyl deaths. Obviously this is in the news a lot, but if you look at the numbers, 84% increase. On the beach, what we'll see is if we get 1 or 2 overdoses, we're gonna expect probably 5 more that day. So we've had times where if we get 1, okay, maybe we'll get another one, but if we get 2 or 3, we already know that we're gonna get more than that. And it happens every time, and we stock up on the NARCAN in all of our trucks even more. So this stuff is going around wherever the main point of sale is. On Main Beach, if you guys are familiar with Huntington Beach, on Main Street, sometimes it gets dealt there. People go around to the bars, and they come down the beach, and that's where they overdose. So it's coming from that one source.
Hay imagen que está aquí arriba es una imagen de fentanil. Y si toma el fentanil solo, él puede reversarlo con el NARCAN, pero si lo combina con algún otro tipo de droga, no hay un modo de ayudar a la persona que lo tomó. Eso puede causar la muerte.
All right, why do plants scare me so much? I've been here to Catalina a million times in 25 years. You've got a plant called Jimson weed over at Two Harbors. And if you cut open that Jimson weed and you take the black seeds out, it's hallucinogenic. And kids might think, oh, it's a plant, it's safe. Well, sometimes right up the street by the fire station here, we've got oleander bushes. Oleander will kill you if you even chew on the plant or chew on the flowers. So people can think, well, this is a Hell's Bells plant up on the right-hand side. If I take that and I boil it, I can make a juice that's going to make me hallucinate. But the psychological effects of all of these plants that become very popular over here on the island, we don't have any way to stop the high temperature that you're going to have, the reduced sweating, the blurred vision, and then the patient simply stops breathing, and we have no way to get them back.
Estas plantas que están en la imagen de la televisión son plantas que tenemos aquí en la isla Catalina. Y tenemos la flor que se llama Jimson weed. Esa la encuentra más en Two Harbors. Y puede ser tóxica hacia los niños o los jóvenes si les saca las semillas de adentro. Puede causar ilusionarse o perder el conocimiento y le reseca su boca y le dilata las pupilas.
Here's another scary one. It's called bath salts. And if you Google it or you go on Amazon, you can order these things that are actually drugs that nobody has any idea what's in them, but kids can order them by Amazon. So if you have a teenager and you open up a package from Amazon and you see something like Vanilla Sky, Purple Wave, Bliss, and it says bath salts on it, it's not Calgon Take Me Away bath salts, it's drugs. And it means the kid is either sniffing it, snorting it, or packing it. So look out for these kinds of names because over in town, you can actually buy them at gas stations, and they're very dangerous.
Estas imágenes son imágenes de un tipo de sal que puede ser comprado en el internet, tanto como en las estaciones gasolineras. Es una sal que cualquier niño puede comprar, la puede inhalar o la puede consumir de una diferente manera y contiene droga similar a la cocaína y puede hacer que tengan una sobredosis.
All right, why is ecstasy such a scary drug? This slide says they want you to think there's a way to manufacture happiness. And most teens that take ecstasy, whether they're at Coachella or Stagecoach or wherever they are, they say they feel sexy. They want to hug everybody. They want to love everybody. A very shy child might feel like they're the talk of the town. They're the popular kid at the party because ecstasy takes all your inhibitions away. But ecstasy is one of the drugs that we see the face of ecstasy, and I'll show it to you in a second, what ecstasy looks like when a child dies from it.
Esta imagen es una imagen lo que se mira, como se mira la Ecstasy. Esta cuando la consumen hace que la persona sea otra persona diferente, quiere, por ejemplo, abrazar a todos, ser el centro de atención de la fiesta, y esto puede llegar a causar la muerte si una persona la toma.
So this is science. Nobody wants science on a Tuesday night. So these are some pictures of the pills that are ecstasy. They look like sweet tarts, don't they? They look like very harmless drugs, you know, pretty color purple, little pink hearts. They put a label on it saying Coco Chanel, Molly, Mitsubishi, 007, cool drugs, right? Rolex. But these are ecstasy and you don't know what's mixed into it. This family was praised for putting a picture of their 19-year-old daughter on the front page of a newspaper. And here's a picture of her, happy, 19 years old, first time she ever used ecstasy. That's what ecstasy death looks like. Every hole in your body bleeds, and we can't stop that bleeding. And we can't stop them, and they bleed to death. They're 105 degrees, up to 107 degrees when they die. That's the face of ecstasy we see in the hospitals.
Esta es una imagen de lo que pasa cuando una persona consume éxtasis. Todo tu cuerpo empieza a desangrar y no hay ninguna forma de que los enfermeros o doctores o los auxiliares te ayuden a parar de que se desangre una persona.
So when I was doing this lecture many years ago in Atlanta, Georgia, this man on the right-hand side walked up to me and he said, I know you're always going around teaching about, you know, teenagers and skinny little kids that are taking ecstasy, but he said, my best friend, Mark Toohey, died of ecstasy, and he was an NFL football player with 3 NFL rings on his hand, and he took his first pill of ecstasy and heroin the night before he retired from the NFL, and he died of ecstasy. Big guys die of ecstasy. Little skinny girls die of ecstasy. Anyone can die of ecstasy. So it's called rolling or candy flipping. Molly is ecstasy, ecstasy is Molly, and it's all poison. So a kid might come to you and say, look, you're a firefighter, you're a nurse, you're a doctor, you're a teacher, you're a parent. I've heard ecstasy is a safe drug. There is no time that ecstasy is a safe drug because we have no reversal agents in the emergency department to take the signs and symptoms away. I've had teenagers come into the emergency department for years and years saying, meth heads are tweakers and tweakers are dirty. Methamphetamine is ecstasy. Ecstasy is meth. And I tell the kids, you're just as dirty, a dirty little tweaker, and you're gonna lose all your teeth. You're gonna lose the ability to control your temperature, and you will die if you keep taking ecstasy. This is the form of methamphetamine that teenagers say they're dirty people. They take meth, they're tweakers. They like the pretty version, ecstasy, and the pretty little pills. Sorry, that was a lot.
Esta es metanfetamina. Los síntomas incluyen respiración rápida, confusión, ilusiones, pánico, agresividad, náusea, vómito, diarrea y palpitaciones fuertes.
All right, we got another drug called ketamine that you might have heard of on the island. It's called Special K, or you're going into a K-hole. Kids can buy this down in Tijuana for $5. It's Catalina. It's a little kitty tranquilizer. And you can take it, the liquid, and you can put it in a microwave and popcorn it. Kids can pack ketamine. They can use ketamine IV. They can snort ketamine. It's very hallucinogenic. And a lot of our really kids that are into goth, they really love ketamine because they can go into as close to death as possible. And just when they get to be close to dead, then the ketamine, they'll make them vomit. And so the kids will have K parties over on the mainland where they'll actually turn their friend over on the left-hand side so they don't swallow their tongue. And ketamine, again, is such a dangerous drug because we, again, do not have a reversal agent for ketamine. Not on the fire truck, not in the emergency department, nowhere. There's nowhere that we can reverse ketamine, and they just stop breathing. So they call it kitty tranquilizer or Special K, or they're in a K-hole, and that's ketamine.
Esta imagen es ketamine, es ketamina. Esta la puede consumir cualquier persona o la puede comprar en Tijuana. Es un analgésico tranquilizante y mucha gente la compra y la mal usa. En cuestiones donde puede causar la muerte y paralizar la persona y los pulmones.
All right, so we want to show you a couple more slides, which is one is huffing. A lot of young kids, especially young kids that are bored, they'll go grab like the computer cleaner, or they'll get Glade air freshener, or they'll get whipping cream, like spray cans of whipping cream. And if your kid goes and takes a can of whipped cream and hides in the bedroom, okay, maybe they're just eating whipped cream. Or maybe you should look to see if they're huffing. If they've got a straw and a Glade air freshener, they're huffing. If they've got computer cleaner and they're in the room and they're sticking it in their nose, they're huffing. And especially if they're an asthma child, asthma makes the airway shut down when they're huffing, and huffing is really dangerous. So we do see a lot of very young kids huffing. They might put in a paper bag and be huffing out of it in school. They might spray the inhalant on their sweatshirt and be sleeping at school, huffing. But whatever it is, it can close their airway very quickly. Look for the chemicals that are in your house, and is your child inhaling something they shouldn't?
Esta imagen enseña cómo adolescentes o niños están inhalando diferentes tipos de químicos. Deberemos de mirar qué tipos de químicos tenemos en casa. Puede ser que el spray desodorante que usemos para nuestro cuarto, nuestra sala, un perfume o, por ejemplo, un detergente contenga un tipo de químico que pueda causar la muerte o algún otro caso de enfermedad, especialmente en una persona que es diagnosticado con asma. Puede ser que lo estén inhalando y uno no puede estar dándose cuenta.
All right, so these are some things the kids can huff. The balloons, whipped cream canisters, whippets. If the kid does any kind of bike riding, like the BMX bicycles and everything, they can be around a lot of nitrous. Or if they know someone who's a dentist and the nitrous cans are missing from the dental office around here, think about huffing. Skittling is kind of dangerous because when the kids are bored and they don't have the ability to get drugs, they can just run over to Vaughn's right up the street here and they can buy dextromethorphan. It's over-the-counter cold pills, but they call it skittling because they can just take 2, 3, 4, 5, 6. They get that same feeling that they got on Ecstasy on Friday, but they call it skittling because they look like Skittles. Super dangerous. So right now we're going to translate in Spanish and English what a kid looks like when they're on Ecstasy. So here's what a child looks like on Ecstasy. They have huge pupils. Huge pupils. They're affectionate. They're loving. They're hugging. They have tachycardia, meaning heart rate that's fast. They're super happy, friendly, and talkative, which is why all my coworkers think I'm in ecstasy all the time. And I'm not. I'm just super happy, friendly, and talkative. But ecstasy makes them really lovey and touchy. But unfortunately with kids with cardiac disease, especially if they've had bad problems with asthma or cardiac disease, it's particularly fatal. But look for those huge pupils with ecstasy. If your kid comes home and they've got huge pupils, they're on ecstasy. But don't be like judging them. Sit them down and say, what were you doing tonight? Open up the conversation about ecstasy. My kids, thank God, are 30 and 32 now. I had no problem raising my kids saying, what have you been doing tonight? Ecstasy is huge pupils. Look out for that.
Aquí indica, y en esta lista en la imagen tiene algunas de las efectos que hace cuando una persona está bajo el uso de la Ecstasy. Algo que debe de mirar siempre es engranda las pupilas de los ojos. Si tu hijo llega a su casa con las pupilas engrandadas, por favor, de no juzgarlos, simplemente tratar de sentarte con ellos y explicarles y preguntarles qué fue lo que pasó esta noche y darles una explicación y explicarles qué tan malo es tomar la droga de Ecstasy. Algunos síntomas también es, va a padecer de taquicardia y va a estar muy feliz y hablar mucho y tratar de ser una mejor persona mientras está bajo el efecto de la Ecstasy.
All right, what does your kid look like if they've been taking gamma hydroxybutyrate? This is a weird drug. A lot of guys take this, especially your football players, your karate kids. They want to get a really defined six-pack, so they drink GHB, normally found in Purell bottles or Visine bottles, and they'll be taking it because the GHB makes them slow down their respirations, but then they feel like it's going to give them a really big six-pack. The problem with GHB is the kids can stop breathing, and until another friend calls 911 to get an airway in them, the child dies. So when we see kids who come in from a workout club, a karate studio, my boxing ring, we want to make sure that if they've got a Purell bottle or a Visine bottle, that we're going to take a look at it and send it to the laboratory because it's probably gamma hydroxybutyrate, which is a very dangerous drug, but it's called GHB.
Esta es otra droga que muchos atletas o personas que quieren denotificar su abdomen muchas veces la consumen, es GHB. Lo que puede causar esto en un niño o en un menor de edad es parar la respiración y en vez de llamarle al 911, hay veces que los dejan ahí morir simplemente. Algunas veces puede requerir que pongan a una persona en respiratoria artificial para que los mantenga respirando.
So heroin's a pretty historic drug. Everyone kind of knows about it and has kind of heard about it in the news and everything. This is still out there, and a lot of people, from what I've heard, is people don't really realize this is still out there with all the other stuff going on. They kind of forget about it. But a lot of what we see is that this is usually adults and not necessarily the kids all the time because this is such a scary drug. Heroin is like, okay, that's a very bad drug. Like we saw earlier with the Jolly Ranchers and the Sour Patch Kids, that's a little bit more friendly, right? The kids see it as less of a drug, even though it's not. So this can happen by injecting or smoking. It's called chasing the dragon. There's a surge of euphoria, right? A lot of these drugs and the opioids are here to make these people feel better. So the reason why these people are taking it is just so they can feel a little bit more happier, feel better in their own body. Their mental functioning obviously goes clouded, and a lot of times, especially when they overdose, they go completely out. And people that take drugs like this a lot think this is totally normal, and obviously it's not supposed to be normal, but when kids start to take it, and they've seen kids go down like this before, and then they give them NARCAN on their own without calling 911, they think this is a normal activity, which it's not. The hallmark sign for all opioids, and especially heroin, obviously, is pinpoint pupils. Pinpoint means they're extremely constricted. So if your kid comes home and they have extremely constricted pupils, that's a sign of an opioid overdose. And heroin, along with obviously other opioids, could be heroin's not prescribed over the counter or given by a doctor, but these other opioids can be given over the counter, right, after you have surgery and stuff like that. So this is something to consider.
Aquí está en la pantalla, están hablando acerca de la heroína. Mucha gente piensa que esta ya no es una droga tan común, pero todavía está ya en las calles y todavía la puede consumir cualquier persona. Y indica una de las cosas de lo que puede estar pasando mientras estás bajo la dosis de la heroína. Te puede causar que te sientas a ser una mejor persona.
Let's end up with what are the things that we can do for health and safety. Why does drug abuse scare me as an ER nurse and a mother? Suicide is the third leading cause of death for teenagers in the United States of America. Kids that use drugs are much more likely to commit suicide. They start as being depressed, and if you ever talk to a teenager that says that they're helpless, or they're hopeless, or they have no friends, or they feel like they'd be better off dead, that's a hallmark sign of suicidal ideation. Get this child help. It's very important that if you know a teenager that's depressed, you need to intervene. You need to be that team member, the person, the friend, the nurse, the firefighter, someone, a parent, an aunt, an uncle, and talk to that child about suicide. Let's talk about good things. Why are we so important as parents, as family members, as society members? Do you know that family-focused life can stop kids from using drugs, and it even stops them from getting involved in drugs? Being in touch with our own children is key. Being there for our teenagers as non-judgmental as possible is essential. If your kid can't come home and talk to you about anything, about sex, about drugs, what are we doing as parents? We're not good for our kids if we're judgmental. Be open to your kids and listen to your kids and your teenagers. Parents, you are the first line of defense for your child.
Aquí están hablando acerca de cómo involucrar la familia en ayudar a nuestros jóvenes y a nuestros hijos. Es tratar de siempre estar enfocados en todo lo que hacen, tratar de escucharlos cuando llegan a casa, tenerles la confianza de que ellos vengan a uno y le platiquen acerca de lo que están haciendo el día al día, y la comunicación entre los papás y nuestros jóvenes y nuestros hijos, porque nosotros somos la línea de defensa que los puede ayudar a sobresalir estas crisis cuando ellos están pasando por esta causa.
I always put pictures of my own kids to show that I don't make them up. There they are, little tiny monkeys that they are, and they grew up to be these gigantic beasts, and they're alive. And I'm not saying my kids were perfect, but I got to tell you, there's never a question that they couldn't ask me when they were growing up. Mom, what do you think about ecstasy? Mom, I've got a friend who's taking heroin. Mom, I've got a friend who's smoking something. I don't know what it is. And you got to be there for them and just be that listening person. Because if we're not there for our kids, they're going to go to their friends, they're going to go to the internet. And we are the first line of defense to our own kids in this world if we can be non-judgmental to them. So there's a picture of me and my kids that don't use drugs.
Aquí ella, la enfermera, está enseñando unas imágenes de sus hijos, dando a entender que cómo es importante la comunicación entre padres e hijos y tener la confianza, en vez de que tu hijo o tu hija o tu adolescente vaya con un amigo a pedirle ayuda, y puede hacer que esa persona no lo va a ayudar. No hay mejor confianza que tener con los hijos y los adolescentes entre la familia y sus padres.
So right here, and then I'm going to turn over to Matthew to teach you about NARCAN, is keep living like there's no tomorrow, and someday soon, sure enough, you won't have one. And that's the dangers of drug abuse. I'm going to turn it over to the smarter one of our partnership here, Matthew Wojcik. And here's the last slide on our set here that says, how do you know if your child is using drugs? Ask them. Don't be afraid to ask your kids, are you using drugs? If you don't, then you might not get a chance to ask them again. I'm going to turn it over to Matthew, and he's going to teach you a lot about NARCAN.
All right, before we get into NARCAN, I just want to add one more thing about this for the parents. I always kind of tell a story because I was amazed when I had this, but we had a call one time. It was an overdose, and it was, I believe, a 16-year-old boy. They were with a bunch of people. They went down to the beach. There were no adults there. It was just a bunch of 16-year-olds, right, in high school. What I always tell the parents is not to underestimate the intelligence of your kid. A lot of parents think like, oh, if I can't see it, it's not there. What we ended up finding was kid overdosed. He was on ecstasy. Put him back in the ambulance and went to the hospital. The police officers showed up, and obviously we had a bunch of other kids there that were taking it that were close to overdosing. But we found that the kids hid the pills inside of the shirt collar of one of the kids. So in order to get the pills in the house and out of the house with their parents, they stuffed them all the way around the collar of one of the kids' shirts. So I thought that was, I mean, super crazy that they would even think to do that. I would have never even thought you could do that. But if you guys have like a t-shirt on the inside of your collar right there, you can rub it. There's actually a little place where you can put stuff in there if you cut it open. So that was one of my first exposures to this on the beach when I was younger, but that really opened my eyes to like, wow, these kids, you know, even though they're younger, they still have huge brains and they're very intelligent, and they will find a way to do it. So NARCAN's really cool. This is more of a recent thing, but because of all the opioid overdoses throughout, you know, the country, this was made. This is really, really cool. It contains the antagonist naloxone to opioid overdoses. It's used to reverse the overdose effects. So what happens during an overdose, the person goes down, they're unconscious, and they can't breathe, right? When you can't breathe, your brain's not getting oxygen. So this is really not good for you to be out for that long, and it can lead to death. It takes place of the opioids on the receptors of the brain. So when the drug goes in, fills a spot on the receptors, and this is what kicks it out and allows the breathing to come back. And it allows to reverse the opioid effects and actually brings them back to life. So the first thing before we talk about this is safety first. A lot of times when there's drugs around, there's other people around that are not super safe, and the drug could also be around too. So when you recognize that there is an overdose or someone is unconscious, keeping yourself safe is the number one priority, right? Bring as many people with you as you can to help. So if you're around a bunch of other people and you're going to go to this one area and you see, hey, someone's down over here, bring other people with you to help is super important, right? Knowing your exit routes and in the area that you're in. So when I'm on the beach, one of the biggest things for us is the bathrooms, right? A lot of our overdoses happen in the bathrooms. I've gone to calls on 4th of July with millions of people on the beach, and I have said, no, I'm not going in the bathroom before we have the police officers with me. So when we get dispatched, I automatically go ahead and request PD, and they meet up with us, and then we all go into the bathroom together. Because some of us have gone in before alone, and you're with someone that's overdosing or other people that are overdosing or taking drugs, and they come at you, and they don't really know where they are, right? So they're going to hurt you. Consider waiting for other professional responders. There is nothing wrong with you calling 911 and not going to help if you don't feel comfortable, especially if the scene isn't safe for yourself. This is super, super important because some people have gotten really hurt by going in and trying to help when they probably shouldn't have, right? So protecting yourself first and from the drug is super important. I'm sure you guys have seen on the news the police officers that have gone and they've taken drugs as evidence and they passed out in the overdose. This is from not using the right protective equipment, right? Or going into something that they don't know. So these drugs, they can be absorbed through everything, right? Through the air, through your fingers. So just touching the drug is even super dangerous, or being around it. The other thing too is I've heard of people that have done CPR and gone mouth to mouth, people have overdosed, and they actually can get exposed to that drug. So thinking through these things before you go on scene is super important. And if you guys can help, it will, right? If you guys have NARCAN, this is gonna be the matter of life or death, right? But before we go into that, I want you guys to really understand this, because this is the most important thing, is for you to be safe. So calling 911, a lot of people forget to do this, believe it or not. When you're in the moment and you see someone that's down or someone that's overdosing, a lot of people just want to go rush on and just go do it right away. But what we recommend, and even if you're a paramedic or a nurse or a doctor, you want the ambulance to get there, right? Because the ambulance is time. Ambulance gets that person to the hospital. So the quicker we can get that person to the hospital, the better likelihood they're gonna survive and not have long-term implications. So Narcan is a temporary solution to a potentially longer problem. I've heard of stories of kids overdosing at home with Narcan and giving it to their friend, waking him back up, and then not going to the hospital. That's not okay. And a lot of people on the street, right, a lot of times it's the homeless population, will carry this on them so they can reverse the effects if it gets really bad. We don't recommend that. We need those people to go to the hospital and get checked out, because there's a lot of problems that can come with that. Assigning roles to people who are coming to help out. So if you come with this big group of people, what you can do is I can say, hey, Kathy, you call 911, I'm gonna go give this person the Narcan, right? So kind of thinking through it in this big perspective about, hey, how can I make this a team effort is super important, rather than just spearheading it on my own. And giving a good description of your exact location. We get calls all the time, if you guys are familiar with VHF 16, is what our lifeguard boats use and the Coast Guard to come help you guys. There are so many times throughout the summer that we get people that, hey, my buddy's having a heart attack, we're off Catalina Island, and they throw the radio and they're doing CPR. We don't know where you guys are, right? Are you guys outside of Avalon? Are you guys on the backside? Are you guys at San Clemente Island? Like, what we want you guys to do, I mean, that's kind of an exaggerated situation, but we get people to call 911, they don't give a good description, like, hey, I'm at City Hall. What we should say is, hey, I'm at City Hall on this street on Catalina Island, and I'm inside, right? Give an exact location or a landmark when you guys call 911. So recognizing an overdose. So what does this look like? What we find a lot is sometimes it's really, really obvious, and sometimes it's not. Some of the obvious ones we get it a lot with the homeless population. Unfortunately, that is quite a frequent occurrence, but considering your location, right? If you guys are at a place where you know there's a lot of drugs, it could be drugs, right? Even if it's not somewhere where there's a lot of drugs, it still could be, but consider where you are, and then look for needles, pills, liquids, and powders. Most of the time we do find it around them, right? So if someone's shooting up a needle, we're gonna find the needle, because they're gonna go out while they do it or after they do it. If you see pills or liquids, anything that looks weird, that gets the hairs on the back of your neck standing up, this is an indicator of it, right? And we're going to show you a video later on that has, there's a few telltale signs that don't get recognized right away in a video, and it is a really good example of kind of looking through and being a detective when you arrive on scene, right? Because you don't know what's going on. And pinpoint pupils, this is super important. We've gone to calls with unconscious people, and the people at call 911 have no idea what's going on. The first thing we do is pop the eyes, and we see pinpoint pupils, and that's where we're like, okay, looks like it's going to be an overdose. We give Narcan, they pop up right away. So pinpoint pupils and snoring respirations are the two that are pretty, those are the telltale signs. So snoring respirations pretty much sounds like someone's snoring, but it sounds a little bit different. It sounds like they're not breathing, but they're trying to breathe. And the patient's going to be unconscious and not responsive most of the time. So I always put here, I did put here some examples. You guys know heroin, fentanyl, oxycodone. You guys have heard of OxyContin, right? Versus oxycodone, and then Vicodin over hydrocodone. So those are the generic drug names, and you can get prescribed Vicodin after you get surgery, right? If you go home or a family member takes too much, they don't read the exact prescription, they go home, and you can't wake them up, and they have pinpoint pupils, that's still an overdose. It doesn't have to be the person on the street shooting up the drug. So I think a lot of people don't consider that. Maybe they have Narcan with them, and they don't know to give it because they're like, oh, this is grandma that doesn't take drugs, but maybe she's on Vicodin and took the wrong amount, right? We find that a lot with the older populations. So how does Narcan work? It comes in this little plunger, you guys see up on the top right. What we're gonna do is it goes inside the body, we shoot it through the nostril. It binds the receptor site, like I said before, and it blocks out that opioid and takes over, and allows the breathing to return to normal. So this next slide is how to actually do it. So what we're gonna do is we're gonna peel it out. Do we have an example of one here? We're going to place this plunger as far up the nose as we can, usually until your fingers hit their nose, and we're going to push, and it's going to pretty much just spray right in. And a lot of people have a lot of questions about, hey, I just put one dose and I'm done, but I have other Narcan. We can push this a lot of times, right? Every 2 to 3 minutes, we recommend doing another dose if they don't wake back up. And there's no contraindications to it too, which is really cool. So I can give this to Kathy right here, right now, and there will be no adverse effects from it, which is pretty cool. So this is what it looks like. It's pretty simple. You just open up this backside, pop it open, go up to the person that's overdosing inside of their nostril and push this little bottom, and that's going to put the naloxone into them and reverse those effects. I think it's the video, right? Can you wait before we play the video real quick? I just want you guys to kind of consider all these things I told you about, like the signs of an overdose. This is the police officers, they're on scene first. I've found that police officers could be really, really good at recognizing this stuff, and sometimes they're not. And they didn't recognize right away. It was kind of a weird one where it's like, what is he? He's just out in the car. That's the call I got. He's out in the car. There's no other information. It takes him a while to pop open the eyes and see the pinpoint pupils, but you'll see what he does when he sees it. So go ahead and play the video.
Pull him out. Get him on the ground. Get him on the ground. Sir. Pulse.
So those are the snoring respirations where it kind of sounds like he's trying to breathe, but he can't.
What's his medical history?
I don't know.
He just picked him up 10 minutes ago.
You just picked him up?
Yeah, he's like, I need some money. Can you put me to work? And I said, yeah.
He's got a pulse. He's breathing, so.
Can you grab gloves?
He's not breathing. I don't know if drug related. Give me a flashlight. I can't see his eyes. Yeah, they're pinpoint.
So right now he's pulling out the Narcan.
Go left nostril. Item 6, Narcan deployed in the left nostril.
Use mine?
Excuse me?
Use mine?
No, it's just the one.
This one?
14, 15. They might get here before
No,
you.
it doesn't go there. It's right there.
Go ahead. So put it on them. There you go. There we go. Hold on. All right. Take it off. Got a pulse, barely breathing. You just sort of take a breath. His eyes were pinpoint.
And then now he's back up. Right as the firefighters go out there, he just pops back up. Okay, so that's a pretty cool video, and
The
this
mass
is, all these
shooting in Las
overdoses are
Vegas
different
unfolded
too.
on a scale that has confounded the public.
That one, he took a while to pop up, right? Sometimes we see this really quick. They come up right away if it's a lower dose when they overdose. This guy was probably on a lot, but the one thing that in the beginning, I don't know if you guys saw, but the cop took a while to figure out what it was. He was sitting there like, hey, what do I do next? And that's totally normal, right? Someone doesn't have medical, background. But if he would have popped open the pupils right away, and there's a few other signs there that could have been an overdose with the snoring respirations, and he did say he's breathing. He was not breathing. He was trying to breathe. We still want to give the NARCAN. So if he would have pulled him out of the car, gone down, checked a pulse and breathing, and then tried to pop open the eyes, he would have seen it and given the NARCAN earlier. So you guys saw how long he was down. That's not normal breathing. That's time that the brain's without oxygen. So that's what we're trying to avoid here. But overall, I thought it was a really good video. I think the reason why I show that is just because it goes from these little steps of being an investigator, of going through, because you could be without the fire department for 5 or 10 minutes, right? So after giving NARCAN, be ready for the patient to be agitated. This happens all the time because these patients go down and they come back up and there's everyone there around them when no one was around them. And they come up and they're super scared and they will try to swing. And they also have, the drugs on board. So that does crazy things when you're when you're overdosing. So when they come back up, expect them to be pretty agitated and they could fight you. So following an overdose, patients will be confused. Obviously, you saw that guy, he was kind of like, what's going on? I've had times where we do this, we go in and there's a group, usually it's the homeless population. You go in, there's someone overdosing, and the other people are going to try to tell you to not give him NARCAN because they don't want to ruin his high, which is unbelievable that people do that, but I've seen it happen. So that's one of those ones where like, I'm not going in there, I'm waiting back. And we did wait, right? PD comes on right away, they get detached pretty much right away. And then we go and give them NARCAN. But that was kind of a weird one too. That was like, whoa, you didn't even think about, that person that's overdosing could, potentially be an issue, but the other people around you can be an issue too. So being prepared for the patient to go out again. Even if the patient appears fine after NARCAN, they should still be taken to the hospital. But if they go back out, we can still give NARCAN again. We can give NARCAN every 2 to 3 minutes is what's recommended. We've had people that come up, we give them NARCAN, they come back up, and they're like totally normal having a conversation, and then right back out again. So what's happening there is the drug's going back in and kicking out the naloxone, or the naloxone is coming off of those receptor sites after it wears off, and the opioid's still in the system and goes back in. So that can happen too. How many times can you give NARCAN? Kind of touched on this a little bit. There's no contraindications in NARCAN, which is really cool. Even if the person's not overdosing, this isn't an issue. Obviously, if they're not overdosing, we don't recommend giving it, but it is kind of a good, rule of thumb to we recommend doing, giving this because there's no contraindications. So even though you are giving a drug, it's not like you're, putting in a line with an IV and stuff like that. NARCAN should be given every 2 to 3 minutes, which is recommended. If the first dose doesn't work, go to the other nostril. This is a big one because there could be a blockage in that nostril you put it in. Pretty rare, but they recommend going to the other nostril if the first one doesn't work. And that's all we got for you guys. We want to say thanks to all you guys for coming out and listening tonight.
And thank you to Catalina Island Health because you brought us over here, and we really appreciate you bringing us over to do this lecture. So we'd really like to thank Catalina Island Health and the fire department for coming and doing Stop the Bleed training today. If there's any questions, Matthew and I are happy to answer, and we can translate them in Spanish. Right. Thank you so much. Invite us back again, and we'll come back and do another lecture on another fascinating topic. Thank you. Good night.